Welcome to the Health Headliner podcast by Tudu Digital. Our content is informational only and not medical advice. Please consult your provider. Now, let's dive into today's headlines.
Imagine if a medication, one that maybe you or someone you know uses every single day for something really personal, like contraception, was suddenly linked to a surprising, well, albeit small, new health risk.
Hmm.
How would you want to understand that information to really get to grips with what it actually means?
Yeah, exactly.
Today, we're doing just that. We're taking a deep dive into a significant new study out of France, published recently in the British Medical Journal.
That's right.
It explores a potential connection between certain progestogen-only contraceptive pills and a specific type of brain tumor. It's called an intracranial meningioma.
And our mission here really is to break down this research for you. We want to make sure you understand the findings in, plain language.
Right.
And explore what it genuinely means for health decisions. And maybe look at the broader implications, too, for women's health and just medical understanding generally.
And we're drawing heavily from the scientific paper itself, and also a health news article that reported on it, to give a balanced view.
Exactly. Both sources are key here.
All right, so let's zoom in on this study then. What was the driving force behind it? Why did these researchers decide now was the time to investigate this particular link?
That's a really good question because it wasn't just like a shot in the dark. The main goal was to assess the real-life risk of this tumor, intracranial meningioma,
Okay.
associated with both short-term use, so that's less than 1 year, and prolonged use.
And prolonged is?
They define that as 1 year up to 7 years, or even longer. And they were looking specifically at oral contraceptives with desogestrel 75 micrograms, levonorgestrel 30 micrograms, or levonorgestrel 50 to 150 micrograms when it's combined with estrogen.
Okay, so quite specific formulations.
Very specific. And what's interesting is, well, we knew that intracranial meningiomas are usually non-cancerous brain tumors, more common in older women.
Right.
And we even knew that some other progestogens were already linked as risk factors.
Ah, okay. So there was some prior knowledge.
There was, but the gap was in the details. Previous studies really lacked specific, granular information on, current, continuous, long-term use of these particular types of progestogens.
I see.
So this study aimed to fill that really crucial knowledge gap, giving us a much-needed kind of real-world perspective.
So with that gap identified, the next big question is, how do you actually design a study to get those real-world answers? Especially for something as widespread as contraception, how did they approach the methodology?
They used a really powerful approach. It's called a national case control study.
Okay.
And they utilized comprehensive data from the French National Health Data System. It's known as Système National des Données de Santé.
That sounds like a massive resource.
It is. It's incredibly robust. It covers health-related reimbursements for over 99% of people in France. So it's a real treasure trove of information for this kind of research.
Wow. Okay, so who were the actual people they looked at in this treasure trove?
Right, the participants. So for the cases, they included 8,391 women living in France who had had surgery for intracranial meningioma between 2020 and 2023.
Okay.
Their average age was 60, and about 75% were older than 45.
And the controls?
For each of those women, each case, they matched her to 10 control women. So that's 83,910 controls in total.
Wow.
These women didn't have meningioma, and they were matched for the same age and the same geographical area.
That matching sounds really important for making fair comparisons.
Absolutely crucial. And then, for defining drug use, they looked at how long women used these specific pills. They made a clear distinction between short-term use, so within the past year,
Right.
and then prolonged continuous use, which was 1 year or more, up to 7 years or even longer.
And did they account for other things, like other medications?
Yes, they did a fantastic job actually controlling for other potentially influential factors that included previous use of those other progestogens that were already known to have an increased risk.
Oh, good. That makes the findings much stronger, doesn't it?
It really does. It adds a lot of weight. So what did all this meticulous data gathering actually reveal? Let's dive into the core findings, especially about desogestrel.
Okay, let's hear it.
The study found a small increased risk of intracranial meningioma specifically associated with the continuous use of desogestrel 75 micrograms, but only when used for more than 5 years.
More than 5 years. Okay, that duration is key.
Duration is absolutely key. And what really stands out is that the longer the use, the higher the risk seemed to be.
How much higher?
Well, for 5 to 7 years of continuous use, the odds ratio was 1.51,
Meaning?
meaning the odds of developing this tumor were about 51% higher compared to non-users.
Okay.
And then for 7 years or more of continuous use, that odds ratio jumped up to 2.09.
So basically double the odds.
Effectively, yes. Double the odds for that longest duration group.
Now, that might sound concerning, but was there any good news mixed in with that finding?
Yes, and this is really significant and frankly probably a huge relief for many. The study showed that this increased risk completely disappears just 1 year after someone stops taking desogestrel.
Wow, okay, so it's reversible. That's pretty remarkable, isn't it?
It absolutely is a very important finding. And they also found the excess risk was greater in certain subgroups.
Like who?
Women older than 45, and also those who had previously used one of those other progestogens already known to be high risk
Okay.
in the 6 years before starting desogestrel.
Interesting. So past history matters.
It seems to, yes. And the risk was also observed more in cases where the meningiomas were in specific locations, like the anterior or middle of the skull base, or when there were multiple tumors.
Right. Now, you mentioned the risk was small. How do we put that into perspective? It's easy to hear double the odds and get worried.
That's a fair point, and the authors address this using a concept called the number needed to harm. It helps contextualize the risk.
Okay, how did that work?
They estimated that for every 67,000 women using desogestrel, considering any duration of use, maybe one might need surgery for an intracranial meningioma because of the drug.
67,000 to 1. Okay, that does sound rare.
It is. Now, if you look specifically at current use for more than 5 years, that number needed to harm dropped to 17,000 women for one surgical case.
17,000. Still a large number, but clearly a higher risk for that longer-term group.
Exactly. But, and this is really important context, this risk is still considered low compared to some of those other progestogens already linked to meningioma.
Like the ones mentioned earlier.
Yes, like cyproterone acetate, for example. That has a much lower number needed to harm, which actually means a much higher risk profile. So desogestrel's risk, while measurable, is comparatively lower than some others we already knew about.
That's crucial context. And what about the other main drug they looked at, Levonorgestrel?
Right, this is the other major finding. Crucially, no increased risk of meningioma was found for levonorgestrel.
At all?
Not that they could detect, whether it was used alone or combined with estrogen, and regardless of how long it was used for.
Okay, so that's incredibly reassuring news for anyone using levonorgestrel-based contraceptives.
Absolutely. A very clear finding in this study.
So moving on from the findings themselves,
Yeah.
what does this all mean practically for, clinical decisions for patients and doctors?
Well, one key implication comes up if a meningioma is identified in someone taking desogestrel. The study suggests that simply stopping the desogestrel and then monitoring the patient clinically and with scans might be the best first step.
Instead of rushing to surgery.
Exactly. It could potentially avoid immediate surgery, which is obviously a big deal. And this actually lines up perfectly with what we already knew about managing meningiomas linked to those other progestogens.
So it fits the pattern.
It does. As one neurosurgeon, Gilles Reuter, pointed out in the related news article, in cases of similar hormone-related tumors, just stopping the medication often means you can avoid surgery altogether. The tumor might shrink or stop growing.
That's really valuable information. So the decision to use desogestrel really becomes about weighing the benefits.
Definitely.
Like reliable contraception, maybe reduced cardiovascular risk compared to combined pills,
Yeah.
against this small increased risk of meningioma, particularly with long-term use.
Precisely. It's a risk-benefit conversation, as always in medicine.
And are there specific groups where prescribers should be perhaps a bit more cautious or have a more detailed discussion about this?
Yes, based on the findings, prescribers might need to consider desogestrel use more carefully in women older than 45,
Okay.
especially if they're postmenopausal or, as we mentioned, if they have a history of using those other high-risk progestogens.
Right. But, this raises a question. Does this mean everyone on desogestrel needs a brain scan now? Should there be routine screening?
That's a natural question, but the answer from the experts, based on this study, is no.
No screening. Why not?
Because the absolute risk is still relatively low overall. Systematic MRI screening for all desogestrel users just isn't considered medically justified or cost-effective.
Okay, that's clear.
Ultimately, it really highlights the importance of looking at the whole picture, a woman's entire history of hormone treatments, different contraceptives, other therapies over her lifetime, because risks can change and evolve with age and cumulative exposure.
That makes perfect sense. Now, you mentioned these tumors might behave differently. Let's dig into the nuances there. The study suggests desogestrel-associated meningiomas, or like hormone-induced meningiomas. What does that actually mean?
It means they tend to share certain characteristics. They're typically non-cancerous, which is good news.
Okay.
They're often found at the base of the skull or sometimes in multiple spots. But here's the really key thing. They often decrease in size or at least stop growing after the hormone treatment is stopped.
Tying back to the idea of avoiding surgery just by stopping the pill.
Exactly. It implies that this type of meningioma might be biologically distinct from, say, sporadic meningiomas that just appear, or ones caused by radiation. They might have different triggers and behavior.
But we don't fully understand why yet.
Not completely. While this study gives us valuable insights into the association and the clinical behavior, many questions still remain about the actual pathogenesis, the biological mechanism of these hormone-induced meningiomas.
So more research needed there.
Definitely. Further clinical, molecular, and radiological studies are needed to really understand these unique tumors and how best to manage them long-term.
Okay. Now, like any good scientific study, this one isn't perfect. It has limitations, right? What are some of the important caveats we need to keep in mind?
Absolutely. And the researchers are upfront about these. First, and perhaps most importantly, it was an observational study, meaning it can identify associations, strong links between taking the drug and the tumor risk, but it cannot definitively prove cause and effect.
So correlation, not necessarily causation confirmed.
Precisely. Though the evidence here, like the duration effect and the reversibility, makes the link pretty compelling, we still have to call it an association based on this study design.
Okay. And what about the data itself? You said the French system was comprehensive, but does it capture everything?
Not quite everything. For instance, information on drugs that aren't reimbursed by the health system wouldn't be in there.
Right.
Also, things like genetic predisposition to meningioma or past exposure to high-dose radiation therapy weren't available in the data. And they didn't always know the specific reason why desogestrel was prescribed. Maybe it was for endometriosis treatment, not just contraception. These are limitations the authors acknowledge.
And you mentioned this study focused on surgical cases.
Yes, that's another key point. They only included women who actually underwent surgery for their meningiomas. So it might underestimate the total number of meningiomas potentially associated with progestogen use because some tumors are managed just with monitoring or perhaps radiotherapy, not surgery.
I see. So we're mainly seeing the more severe or symptomatic cases in this data.
That's likely, yes. And one final point. The study had a bit less statistical power to analyze levonorgestrel alone just because fewer women in the data set used it that way compared to desogestrel or combined pills.
Okay.
But even with these limitations, it's important to stress the study's use of comprehensive real-life national data and its careful attempt to control for confounding factors like prior drug use really does improve the reliability of its findings. It's a very well-designed study within that observational framework.
Okay, so summing it all up then, what's the core takeaway from this deep dive?
The core takeaway seems to be this. For the millions using desogestrel, particularly for longer than 5 years continuously, there appears to be a small, measurable, but importantly reversible increased risk of intracranial meningioma.
Reversible being the key word there.
Absolutely. And for those using levonorgestrel, based on this large study, the news is entirely reassuring. No similar link was found.
So this really isn't about causing panic, is it?
Not at all. It's about having powerful new information. It's about empowering you, the listener, to make informed health choices in discussion with your doctor.
Yeah.
This study really highlights how our understanding of common medications can evolve, especially with long-term, real-world data. It just encourages a thoughtful conversation.
A conversation with your healthcare provider about your individual health history, your contraceptive choices. Understanding that medical science is always learning, always refining its recommendations.
Exactly. It's an ongoing process.
It does make you wonder, though, doesn't it? What other commonly used medications might have evolving long-term profiles that maybe we should be asking more questions about?
That's a really interesting thought to leave people with. Always more to learn.
Thanks for tuning in to the Health Headliner podcast by To Do Digital. Like and subscribe for more health news and breakthroughs. Stay healthy and informed. See you next time.